Hello everyone, my name is Anastasia. I am a musician, pianist, organist, and breast cancer patient. I was diagnosed with breast cancer stage 4 2 years ago, and I had metastasis to my bones and to my lungs. I've been getting first line treatment, aromatase inhibitors, and Kisqali, ribociclib. I tried all three aromatase inhibitors. I started with letrozole, then continued with anastrozole, and tried exemestane because my doctor thought it could affect me less, not give me as much pain as I started experiencing after 6 months. After I started my treatment, but it didn't change anything. All three of them were bad enough. And he thought it was neuropathy, so he prescribed me, instead of my Lexapro I was already taking at that time, he prescribed me duloxetine, but it didn't help. And then he sent me to orthopedic doctor, hand doctor, and doctor told me that I have all three bad side effects. It affected my right hand. So it's carpal tunnel, tenosynovitis, Quervain, and trigger finger. He didn't recommend me physical therapy. He started straight away with the cortisone injections. And yes, cortisone injection worked for 3 months. And then it came back again. We did another cortisone shot. It gave me relief for 3 months. And after the second shot, my doctor said, okay, let's do surgery. And as you know, surgery, it's your last resort. I didn't want to do that. And I started looking for another options. I had found a specialist, acupuncture specialist. And after 3-4 sessions, I thought that no, it doesn't help. So I stopped going to my acupuncture specialist and started thinking about, okay, probably I need some kind of physical therapy. And I found all kinds of devices like this. Thought probably that will help. The stretchers, this. No, didn't work. And I started wearing splints at night. So like this, splints, and for my hand at night. Yes, it helped. At night it helped. But during the day, no, it didn't. I still was having pain, especially it affected my hands with playing. And I just decided to, okay, let's do surgery. So in July, I did surgery. So carpal tunnel release, tenosynovitis, Quervain, release. Achilles and the tendon sheath, here for my trigger finger, my third finger, trigger finger. Trigger finger was the worst for how it was healing. It took probably a month for scar to kind of minimize. These two incisions and healing process was pretty smooth. So now I'm 3 months after my surgery, and I'm still having pain, especially at night with my trigger finger, but I can tell you it's getting better. So I decided to record this video because I tried to find information about how cancer patients dealing with this pain, because it's a very common side effect. But I couldn't find the thread like on breastcancer.org site or different breast cancer patients forums. So patients for some reason don't discuss that. And I thought that probably my video can help those who's continuing battling with breast cancer as I do. So I hope my video helped you, and if you have any questions, please don't hesitate and write a comment. I will be glad to answer. Thank you so much for watching.